Good afternoon, or good evening, I should say. My name is Christine, and I'd like to talk with you about the ins and outs of ostomy accessories. Some people need them, some people don't, and we'll talk about whether or not it's right for you. So I do work with HPFY, and most of these products that we're going to talk about are available on the HPFY website. We're going to hold all questions until the end. You can certainly write them in the question and answer section, and then we'll approach those questions, and I'll be happy to answer them for you at that time. So I'm just going to go ahead and get going with these accessories. So living with an ostomy certainly can be overwhelming, and the accessories really are made to enhance the performance of your pouching system. And there's so many out there. Some you may need, some you might not. The least we have to use, the better. But in this webinar, we're going to just discuss each one of those and whether or not they're appropriate for you. So we'll start with the skin protective agents. So these agents are used to protect the skin and increase the tackiness before you place your barrier. Some nurses don't recommend them. I do. I'm very proactive in managing your skin. So I do recommend that you use one regardless. One of the top brands is the 3M Cavalon, and it is available in sprays, and it's also available in wipe form. There's also Medline. This is another good one. It's alcohol free, just as the Cavalon is. And I don't know if you can see that. So this is the Medline, alcohol free, comes in wipes and in spray form as well. And then Convatec offers a new product called Ascenta, and that is also sting free. And then there's other things that you can use as barriers. If you have to use a stoma powder because you have reddened skin, or maybe you have a fungal rash and you need some antifungal powder, you do need to use a barrier film over the powder because your product won't stick to powder alone. So stoma powder, they will look something like this. There also is a product called Caraya powder. It has a gum component to it, so it helps with adhesive. So both, again, you would need to use your barrier film over that. And then if your skin is really raw and broken down, I do recommend Marathon. This you would not use with powder. You would use this alone. And this is meant to be used on skin that is raw, moist, and weepy. So if you're using some of these significant adhesive products, sometimes removing the residue will need to be done on occasion. I personally don't like to use the adhesive removers. If there's any residue left on your skin, it can hinder your next product from sticking well. So you do want to make sure after you use an adhesive remover that you're cleaning the skin with just plain water. Convatec has this really nice one. It's called Sensi Care, and this is in spray form. It also is available in white form. They also, Convatec came out with this new one. It's called the Ascenta. So just like the barrier film, they also have the adhesive remover, and that is available in spray form or wipe form as well. Now, caulking agents. So think of this product as something like the showers in your bathroom, your tiles in your shower. They have caulking in there to prevent water from dripping behind it and getting back there and creating moisture. So there are a number of these products. They come in barrier rings, and these, I'll just open it. This one happens to be a Hollister. Hollister does offer a ceramide. Ceramide is good for helping to rejuvenate the skin. But these rings, they're kind of like silly putty. You would go ahead and stretch this to fit your stoma. And you can place it actually right on the back of your wafer, or you can place it on your skin around the stoma after you've used your skin protecting. So that's the Cera ring. And Coloplast Brava has a protective seal, very similar to that moldable ring. It's white. Also, it's shapeable to fit around your stoma. They come in various thicknesses, slim, and a 4 millimeter thickness. This particular product has the ability to absorb moisture. So if you have an ileostomy or a urostomy and a little bit leaks underneath the wafer, that moisture will absorb right into this, so it's not sitting on your skin. So it's perfect for those type of ostomies that have thin liquid. There are also E-Conceal. This is made by Convatec. Similar to the moldable ring, I find them to be slightly drier than the moldable ring, but some people really love this particular product. Again, it looks very similar to that moldable ring, and you would shape it, okay, to fit. They also are available, as with some of the other companies, they come in a 4-inch size. So here's your 4-inch. If you need, extra protection, certainly all around that peristomal skin, you could certainly use this. All right. And then there are other products that are silicone gels. And you can see the picture here, Silken. This works really pretty well. They also make some silicone rings as well. So barrier extenders. So these are great if you're swimming, or you want to just, maybe you're going to be active and go out and do things in these summer months, and you want that little extra surface adhesion, makes you feel a little bit more secure. So these are Coloplasts elastic barrier strips. Once you peel the back off of that, they're actually stretchy, so it will fit pretty good. Usually you would use 2 of these around your base plate. And that it's very nice. They peel off nice. They're gentle to the skin. The edges are beveled, so it doesn't get caught up in your clothing. They do make them in larger sizes. So if you have a larger barrier, so this is extra wide. And then if you're problematic at that 3 and 9 o'clock position, and what I mean by that is your sides like this, they come in a Y shape. So now this is perfect. It gives you that extra extension off to the side. Convatec has their version, and I don't have them with me, but I do have a little card. I don't know if you can see that, but theirs is called Ease. It looks like you can't see that. Hollister has their brands, which are called, what are they called? The barrier extenders. So any of those products certainly are good. You'll see also on this slide a picture. It's called a Sure Seal ring. If you have a stoma, you've had an IV, all right? Those IV dressings that are really thin and filmy, that's what this Sure Seal ring is made to be. It's very thin, filmy, will waterproof your barrier. And these are great. They're made by Active Life products, and they have round ones that are smaller, and then this square one, which is their larger size. But that's perfect for summer and for swimming. All right, so if you want that little extra security, or you tend to have a problem with leakage, some people have problems at night because they move around and roll around in bed. They make these belts, so they're adjustable. All right, they have a little small hook here, and on this barrier, they have these little tabs here. So you would put the belt right in there. All right, and hook it like this, wrap it around the body, and you're going to wear it snug. Not too tight where you're uncomfortable, but you do want to wear it snug. It is adjustable. They make a smaller and a larger size. And what that does is hold your barrier closer to your body so that it's less likely to leak. So if you have a problem at night, I would recommend you wear the belt at night. The problem with these belts are sometimes they tend to ride up in the back. So New Hope came out with this belt, as you'll see on the bottom, which it Velcros closed instead of hooking onto the barrier or the pouch. And it has that ring in the middle there for support. So that's a really nice product if you're looking to have a little extra support. Now, support belts. So these belts are really made for people who are prone to hernias, or if you're very active and you're doing strenuous things or working out, If you do any heavy lifting, you are at risk for developing a peristomal hernia. And so these belts will support around where your ostomy is. So New Hope, you'll see one picture there, but I have one here, and they are elastic, and they do, I don't know why things are blurry here, but it has this opening and it's reinforced right here so that it offers support right where that is. Cool comfort, so it's nice and mesh-like, and these are available in any size from 3 inches up to 9 inches. So depending on how wide or how tall you are, you'll get that much support. The largest size is 52 inches long, but if you need something larger, they do custom fitting for that. And if you give them your measurements, they will be happy to make one for you. And then let's see, Coloplast offers a ostomy support belt. All right, and that will look like this. It's got a little pocket here, not a pocket, but something you can get your hand into. Sorry, having a little trouble there. And that allows you to tighten it around your abdomen and cover and get it stuck there. But there is on the inside of this, there's an area where you're going to cut the opening and it is supported. So if you use a regular abdominal binder without any support for the opening, it's going to just stretch and not give you the support where you need it. So these belts are specific for people with stomas. Safe and Simple offers these belts as well. They come in black, they come in beige. The Coloplast one only comes in white. So odor. So here's lots of accessories here for controlling pouch odor. So lots of them out there. I recommend you try them. Most of them come or are available in Safer Home. You get an 8-ounce bottle. And each time you empty your pouch, you would go ahead and put some of these drops in there. Most of them also are available in these small sizes for travel. They're about a 2-ounce bottle. So if you're on an airplane, you'll be able to bring that. They also make packets. So these are great. You can keep them right in your pocketbook. Again, great for travel. And another product that I found out there is called Devco tablets. These tablets, they look to be like there's charcoal inside in the tablet, but you would put a tablet into your pouch each time you open it, and that will help decrease the odor as well. So then there's also numerous types of biologic air freshener room sprays that are out there. Hollister M9 is a very good one, and it is available in unscented and scented. A lot of these also come in small bottles like this, great to carry in your pocketbook. Highly recommend that. It's great if you're in a public bathroom. All right, and now there's some internal types of deodorants that help minimize odor of the digestive tract. So Devram tablets, these you can certainly find out there on the website. HPFY carries them as well as the Devco. This you can take 1 to 2 tabs 3 times a day. This will help with odor as well. There's another product out there called chlorophyll tablets. Chlorophyll has other health benefits for you, but it's great as an internal deodorant. And then there's your natural way, certain foods, parsley and yogurt help with that as well. All right, so do you need convexity? So not everybody does. We typically would recommend convexity, and let me show you what a convex wafer is, or barrier. All right, that is this one. If you can see that, it's raised here rather than flat. So the types of stomas we would recommend convexity for is if the stoma is flush with the skin. That pressure on the barrier close to the stoma helps that stoma pop out a little bit more, so you're less likely to leak. If your stoma sits below the level of the skin, we call that inverted. We would recommend convexity for that. And then there are some people whose stomas retract in when they sit. So it just has to do with contouring of the abdomen. If the stoma sits in a fold, I would recommend that convexity. Some, it depends. Not everybody with a stoma in a fold needs convexity. However, often they do. But you would have to fill in those uneven surfaces first. And this is called strip paste. It's made by Coloplast. This is perfect for skin folds. It's very similar to the moldable ring. It stretches, it's sticky, and it would just fill in that gap so that you have an even surface for your barrier to stick to. So standard wear versus extended wear. So colostomies typically would use a standard wear product. They look exactly the same as extended wear. You will not notice a difference. But the difference is extended wears hold up to that liquid or acidic output better than a standard would. So each of the manufacturers have their own terminology that they use for standard wear. Coloplast's term is your regular standard wear. Hollister, they call theirs flex wear. And their new image, if you're using a 2-piece or a 1-piece, they will call it flex wear. Convatec, their terminology for standard wear is stomaadhesive. And then we'll look at the extended wear products, which again are better for ileostomies and urostomies. Coloplast's term is X Pro, Hollister's is Flex Tend, and Convatec is called Duradhesive. So just make sure if you have an ileostomy that you are in a product that is extended wear. That may hold up a little bit better and give you better wear time. Incidentally, I think wear time for ileostomy, I would never go more than 4 days, but about 3 days is average. Wear time for people with colostomies typically is 5 to 7 days. All right, so Stoma Protection, there's a few products out here. I've only listed a few here, but if you're into contact sports or doing things that can injure your stoma, these products are really good, very supportive. So Stoma Dome, that is the bottom white one. That one does not require a belt. I would recommend you go to the website and look at how it's used and how to wear it. And people use these Stoma Domes even just to minimize, believe it or not, their pouching system. Stoma Gear is the middle one. And then the other one, I don't believe that one is Stealth Belt, but Stealth Belt does have one. So these are just 3 different versions of a stoma guard for protection. Now, personal garments. If you've seen any of my webinars, I always talk about Ostomy Secrets, and they have really good quality products. So when they offer the women's panties, it has a pocket on the inside to offer support to your pouch. Same with the men's boxer briefs. There's a pocket in there that supports the weight of the pouch. The wraps, these are unisex. They do have some lacy ones for women, but the wraps are wonderful. It's kind of like one of these tube tops, and there's a pocket in the side of this on the inside. This is great for stomas that are up above the belly button, where you might see the outline through your shirt. Especially men, they typically don't wear very blousy types of tops. So these are perfect, great for that. It will minimize the look of the pouch, and it will also offer support to that pouch as it fills. And then there's swimsuits. So here I did Ostomy Secrets, their swim skirt. They also offer swim shorts. Here happens to be one. Again, it has the pocket on the inside to offer for your pouch. So swim shorts. For men, they do have swim trunks. And there also is a product out there called a swim wrap. That is made by Ostocare swim wrap. And then pouch covers. Some of them are more water resistant, but some are more for looks alone. Oh, actually, I did want to mention Ostomy Secrets. They have a brochure, and you can get 20% off on your first order. And I guess I could put in, I'm so sorry that you can't really see that. It seems very blurry. Oh, there it is. They have a 20% off coupon. It is style 20, and they'll allow 20% off on your first order. So in closing, accessories are made to enhance your fit and wear time. We do want you to enjoy a normal life and really get out there and feel comfortable. So thank you for sharing your time with me, and I'd like to answer any questions that you might have. So again, most of these products are available on the HPFY website. If you have another supplier, again, most of these products you can get through those suppliers as well. Looks like Bobby raised his hand. If you could put your question into the question and answer, that would be helpful. What do you recommend for a granuloma that bleeds sometimes? Okay, so actually, that happens quite a bit. I would recommend seeing your surgeon. They can cauterize it with silver nitrate. Depending on how large the granuloma is, it might have to use silver nitrate a couple of times, but that should stop it from bleeding. Oftentimes they go away as we burn them. It's a chemical burn, and that will improve your wear time if it's affecting that.
Fiona would like to know, can you sleep in a hernia belt?
Well, you can, and that's again is going to be dependent on your comfort. For people who have some very large hernias, or if you're very active and moving, it probably is a good idea to do that. But again, it's going to be your comfort. Typically, those hernia belts are meant to be worn snug. So as long as it's comfortable, I would recommend it. All right. So Babette. Oh, hi. Bobby. I've spoken with you in the past. So you have psoriasis under the bag, which has spread to all of your skin. How can I get the urostomy bag to stick when the skin is red and burning? So for that problem, I would recommend the Marathon. Some insurances do cover it, and talk to your dermatologist. Some people with psoriasis go on a biologic that will help improve the symptoms and the skin from a psoriatic outbreak. And that certainly will help your pouch better. But try the Marathon if you can find it. It is carried on HPFY, and check with whoever supplies your ostomy supplies.
Marcia would like to know, what is recommended for a herniated ostomy?
Okay, so a peristomal hernia or a prolapsed hernia. So there's a difference in both of those. I want to make sure I'm answering for the right thing. If you have a peristomal hernia, typically we don't repair them unless it creates a problem. So if they become very large, and it could be problematic, you might have some aching in that area by the stoma. That would require a surgical repair. And with that surgical repair, they do use a mesh underneath there. I mean, let's face it, you do have a hole in your in the muscle, which is why there's such a weakness there, and more prone to develop a hernia. So they do repair it with mesh. And if that's the case, I would recommend that you use a hernia support belt for any type of activity that can cause it to reoccur if you've already been prone to it. If it's a prolapsed stoma, typically prolapsed stomas, a lot of times they don't cause pain, but if it is painful and the prolapsed stoma has come out quite a bit, You can at home place table sugar over the stoma. That leaches out the fluid, so it decreases the swelling, and that allows it to go in. Usually you would do this while you're lying on your back. Gravity will pull the stoma back in. It may take a little while, like, maybe anywhere from 10 minutes to 30 minutes. And you could gently push on the stoma to get it to retract. New Hope's Ostomy support belts, they do offer on them a flap that velcros over a prolapsed stoma to offer support for that if you happen to have the prolapse. So Marcia, I hope I answered your question. If I didn't, put another question in there.
Anyone else?
So typically we do this every month. I apologize. I was not prepared and did not pick my topic for next month. So I guess I will surprise you next month what we're going to talk about. If you have any suggestions, certainly put it in the chat room. So Bobby, you can't sleep because of the burning and itching. Oh, and you started light therapy. Okay. I'm not as familiar with all of the skin issues. So I certainly hope that light works. I'm not familiar with it at all. Sleeping. Have you tried doing not an anti-itch, but something like Benadryl to help? It does help with itching. It's diphenhydramine. You can buy that over the counter. You can try that. I know that the skin underneath your pouching system, we really can't apply anything topical. But if it's outside of the pouching system or the barrier, you probably could use something like Aveeno or a topical cortisone cream over the counter. Might help with the itch. Anything for poison ivy type medication might help with that itch as well. And Benadryl is also available in a cream or lotion form. So those are fine for skin that is not underneath your barrier. And Bobby, you'll have to keep me posted. I'd like to know how that light therapy works for you. If you have suggestions, if there's something you really want me to talk about as far as your ostomies go, throw it in the chat room or send me an email, because I'll be happy to give you whatever information you need. 2 to 3 times a week. It takes about, that's a long time. Hopefully you'll get relief a little faster than 6 months, Bobby. And how long ago did you start? Oh, you just, okay. Yeah. So you got, hopefully by the time you hit 1 to 2 weeks, you'll start to see an improvement. Keep me posted. Let's see, so something in the chat room from Marilyn. What's a good ratio to get good hydration? So, let's see. So, that's a tough question, because the more you, and hopefully I'm assuming you have an ileostomy, because we worry more about dehydration with ileostomies because the output is so watery. The more you drink, the more output you have. So typically, especially in the summer, you also have to take into consideration the weather outside. If you live in a humid environment, you're going to sweat some moisture out and you have to replace that as well. So you do want to replace as much as you're losing, but above that. So typically on a normal day, everybody's supposed to drink 6 to 8 ounce glasses of fluid a day to stay hydrated. For someone with a ileostomy, I would say you'd have to up that a little bit to be more like 10. And you also lose some electrolytes and minerals through that ileostomy. So if you're drinking lots and it's more watery because you're drinking lots, you're also losing potassium, you're losing sodium, you're losing magnesium. So you do want to be able to replenish that type of electrolytes. And you can do that through sports drinks. You can eat a banana to replace some. Bananas are great to help thicken the stool up anyway with an ileostomy. You can snack on pretzels. Pretzels add the salt, which you can lose through your ostomy. I know salt really isn't good for you, but with an ileostomy, you do have to pay attention to that. And also pretzels will help thicken the stool as well. So, and I don't know if you've measured your output, if it is an ileostomy. Typically, the ratio is you don't want to lose more than 1,500 cc's in a 24-hour period. So if you're staying under that and staying hydrated and drinking plenty of fluids, that's good. But if you are getting over 1,500 in a 24-hour period, and I would suggest you measure it for a day just to see how much you actually have outgoing. Then we're really worried about the hydration status. So a thickening agent would be appropriate, something like Imodium. You can talk to your doctor, or adding fiber. I mean, that you can do without needing a prescription. But if those are not effective, certainly call your surgeon, and they can order you something that is prescription strength that will help thicken the output for you as well.
Oh, Lenora has a question. She had hernia repair in April, but I think it might have injured a muscle this past weekend. Could I have pulled a muscle? What should I be doing? It hurts when I walk.
Oh, okay. So, two things I would recommend you do. Number one, you do want to support that area. So if you get yourself the hernia belt, and Lenore, I think we've been in contact previously. So definitely a hernia belt will be good for you. But in the interim, if it's muscular, I recommend applying heat. Heat increases blood flow to the area and it relaxes the muscle. So that's going to minimize your discomfort. If you're able to take Advil or Motrin, I would recommend you take 2 to 3 of those 3 times a day, just for a week. Make sure you take it with food so that it doesn't irritate your stomach. So the ibuprofen or the Motrin help reduce inflammation in the muscle. It's also an analgesic, so it should help you feel better. Between the heat and the ibuprofen, if you're not better in a week, I would say it's not muscular. And that would warrant a discussion with your surgeon.
Any more questions? Oh, I think we do. Lenore said thank you.
Oh, you're welcome, Lenore. So Diane, we didn't get any suggestions yet for
next month's webinar. What would you like to hear from us? Yes.
Yeah, I'd like some ideas.
Any ideas?
Well, we have a raised hand by Marcia. Or
Marcia or Marcia. Can you type it in the Q&A?
Oh, it's Marcia.
Oh, sorry.
That's okay. Sorry. I have a daughter-in-law whose name is Marcia, and she spells it just like Marcia. All right. So a question about leakage. What can you do about it? And you get it all of the time. So are you using something like the protective seal? I would try adding this. Okay. And I would assume that if you're getting leakage all the time, that that maybe your skin is on the red side or breaking down. So you said yes. Are you using this protective seal? That's a good idea. Maybe try using the belt. Oh, your skin is in good.
Skin is good condition. Yeah.
Perfect. All right. So you're catching it off. You're catching it early. That's really good. So I would add the belt or a colostomy. You wear the belt and you have it.
Ileostomy.
Okay. So, all right. So what else can we do? How about, is it very watery? Because it's more apt to leak if it's watery. You can try a gelling agent. There's a couple of them out there. I should have put this in my in my webinar, but I didn't think about it. But this is called Illisorb. It's kind of like those, when you buy a new pocketbook or shoes, you find those little things that absorb moisture in it. This will turn the watery output into a gel, so it's less likely to leak. They make tablets called Gel X tablets that will also turn it into a gel. So I think that would help quite a bit. Good. So you're telling me it is watery. So let's try the thickening agent. I think that will help you quite a bit. And I'm happy to help, Marcia. So where do you get it? You can buy these anywhere you get your ostomy supplies. They should have this. This particular one is made by SciMed. It's actually, I'll put it in the chat room for you. It's called SciMed. Yeah, so I think you'll do very well with that. You're welcome, Marcia.
No suggestions for next month yet?
Oh, darn. Well, maybe they'll email me when they think about it.
Yeah, sure.
And actually, I will put my email in that chat as well.
Oh, food choices.
Oh, yeah. We
I
could.
never thought of that. Yeah.
All right. I'm gonna write that one down. Diet. Well, I think some of my webinars, we did touch upon diet, but we didn't do one solely on diet. All right. And we can talk about picnic foods.
Oh, that sounds good.
Yeah.
Marilyn has a question. Says her output is very watery, so I changed to a convex barrier. It works. Okay.
Perfect. Perfect. So, Marcia, if you have a flat barrier, try adding the convexity. That may help quite a bit. And you can still use the barrier, the protective seal with the convex appliance. And you can still use a belt as well. Thank you for that suggestion, Marilyn.
Any more questions, suggestions?
Okay, so maybe we'll wrap it up. If anybody does have additional questions, feel free to shoot me an email. I typically am on in the evening, Eastern Standard Time, usually on Mondays, Tuesdays, Thursdays, and occasionally I'm on the weekends. So if you have any questions, certainly feel free to shoot me an email. I will get back to you. And thank you for attending the webinar.
Yes, thank you all for joining.
All right.
All right.
Thank you.
Good night, all.